Welcome to Magic Moments with the Medicare Professor. I'm Patricia Mitchell, your host today, and we're going to learn all about Medicare. And we're going to take this Medicare and You manual one section at a time. So we are educators at Magic Insurance Agency. We want to educate you about your choices and all about Medicare so that you know what fits your needs and what fits your budget. So stay tuned and thank you for tuning in. Medicare is a complex subject. We've been working with Medicare eligibles since 2007 when my grandmother passed away. And when she passed away, we were able to get our license and start working in the insurance industry, which is a blessing. For us, our family has grown since we started working with Medicare. We have thousands of clients who are our extended family. We treat our clients first class, and we thank you for tuning in and possibly wanting to be one of our clients at Mitchell's Advisory Group. But this is a moment for learning all about Medicare. So the first section of the Medicare and You manual, and we're using the 2021 version. So what's new? Of course, coronavirus. Coronavirus 2019, coronavirus 2020. Medicare is committed to getting you the information you need for COVID-19, and so is Mitchell's Advisory Group. You will see a segment at the end that shows how we are prepared to combat the spread and transmission of the coronavirus. Lower out-of-pocket costs for insulin. In one of the videos you will see, my husband, Gregory Mitchell, will talk about the insulin savings program. In addition, Medicare Advantage and end-stage renal disease. Y'all, this is a big one. So the end-stage renal disease, people on dialysis because of the Cures Act are now able to get Medicare Advantage Part C plans. Prior to 2021, people who were on dialysis suffering with end-stage renal disease were not allowed to enroll in a Medicare Part C plan after they contracted or were disabled with the end-stage renal. So now, because of the Cures Act, you're now able to enroll in a Medicare Advantage plan. Now, we just finished with the annual enrollment period, and we're moving right into the open enrollment period. So just because you missed the annual enrollment period doesn't mean that all hope is lost. So stay tuned to learn how you can get enrolled in a plan of your choice. Acupuncture for back pain. Now, I am an avid chiropractic lover, acupuncture lover. I believe in getting those holistic procedures done to stay off of the pills. Okay, so check into those. If you've not tried acupuncture, chiropractic, it may be something that can help you. Now, telehealth and virtual. That's why we're here today. We are virtual today because of coronavirus. And this is something that I've long since wanted to do, and my clients have asked me to put out videos teaching all about Medicare. So the virtual learning, my children at home, they are virtually learning. And so we're here virtually teaching you all who are tuning in today. And get help with your Medicare choices. That's why we are here. The Mitchell's Advisory Group or Magic Insurance Agency is here to help you get the information you need to make the best decision for you and your budget. And we help you compare those healthcare choices through Medicare.gov's website. And we're going to get started with Section 1, which is signing up for Medicare and getting started. So, getting started. If you're new to Medicare, there are two main ways to get your Medicare coverage. Original Medicare Parts A and B, and Medicare Advantage. there are certain periods when you can sign up. If you see the chart that is on your screen, certain times of the year when you can enroll in Medicare or Medicare plans. October 1st, 2020. Start comparing your current coverage with other options. October 1st, 2020. This book gets sent out to you. The insurance companies start mailing you out your annual notice of change if you're already enrolled in a plan. And the number one thing, the insurance agencies, insurance companies are going to send you 150 pieces of mail trying to get you to call them for to get your information to enroll. I have received so many calls from clients saying, hey, Patricia, I got this in the mail. I don't know what it is. Am I supposed to do something? It says I need to call now. It is a marketing device to get you to call so they can enroll you in the plan. You don't have to do anything but call to find out if you are eligible for coverage options. So we can help you with those coverage options. We can help you with your extra help in Medicaid, which we'll talk about later. So October 1st is a time to start comparing. October 15th through December 7th, we just finished with the open annual enrollment period. This is a time when people can change from their existing plan, if they have one, to a new plan. This is a time where people with original Medicare, those of you who have this card, this is the new Medicare card, which has a series of lottery numbers and letters that indicate your Medicare number, and it has your coverage dates on it. So if you have both parts A and B, not just A or not just B, both parts A and B, you can enroll in a Part C plan, Part D plan, or Medicare supplement plan. And we'll talk about those more later. So now's the time, October 15th through December 7th is the time we just finished, to make your plan choice. Now, you say, Patricia, I missed that period. Well, January 1st, new coverage begins if you made your change. And you don't have to change anything. But if you keep your existing coverage and your plan costs and benefits have changed, if you kept them from 2020, if your plan benefits have changed and you learn that your copays have gone up, your premium has gone up, you can, at January 1st, make a choice to change during the open enrollment period. If you're in a Medicare Advantage plan, you can change to a different Medicare Advantage plan or switch back to original Medicare and join a separate Medicare drug plan and a Medicare supplement from January 1st through March 31st. So don't delay calling to find out if you're eligible for lower out-of-pocket costs, lower monthly premiums. Now, what are the parts of Medicare? Part A, hospital insurance, covers inpatient care, skilled nursing, hospice care, and home health care. And so as an educator, I always use mnemonic tricks, and we always talk about real world scenarios to try to help our students learn the subject matter that we're teaching. So when we talk about hospital insurance, you see that building that is on the screen. That represents the building. So Medicare Part A hospital insurance covers the building and the people that work on that building. So you're talking about the groundskeepers, the maintenance people, the cafeteria workers, inpatient care, your overnight stay. So it's like a hotel insurance. So Part A is like you're paying for your stay there. It's like hotel insurance, okay? Like an Airbnb, right? So Part A hospital insurance. Now, when you get to Part B medical insurance, you see a stethoscope there. Who wears a stethoscope? Doctors. Doctors wear a stethoscope. Nurses wear a stethoscope. Okay? The anesthesiologist wears a stethoscope. So the people that work on you to make you better, that's what Part B covers. It covers services from doctors and other healthcare providers, even if you're in the hospital, even if you're in a skilled nursing facility. Covers outpatient care from those doctors, home health care, durable medical equipment. It's also covered under Part B, like your wheelchairs, your canes, your walkers. And most preventive services you get, like your screenings, your shots, your vaccines, and your yearly wellness visits. So a lot of people get those two confused and saying, I don't want to get Part B because it costs $148. Now, I'm telling you a lot of information that later on you may be able to take a quiz and get some prizes. So make sure you take good notes and circle and highlight as you're going through this book, because you may be able to win some prizes at the end of these videos. So Part B does not cover, Part B, you need both Part A and B to get that full coverage. If you only get Part A, it's only going to cover your room and board stay. So that's why you get a bigger bill if you don't have Part B. And I hear it a lot of times from military individuals that have been in the military, retired with Medicare. I hear it a lot from people who have employer group plans. I don't need Part B. Part B is $148.50 this year. So I don't want to pay that. I'm not sick. I don't go to the doctor a lot. Well, as you learn later on, if you don't get Part B when you're first eligible, you will have a 10% penalty for every month you don't have the Part B, right? So don't delay getting your Part B. And if your income is low enough, you may qualify for help to get that Part B paid, okay? So we'll talk about that a little bit more later on. Now, Part D drug coverage. Part D is the newest part of Medicare. So original Medicare, and this is a test question, original Medicare started back in 1965 under which president? Okay, so find out which president was there when Medicare Part B started. And Medicare A and B started in 1965. And under that president, they decided to start a federally mandated health programs for people 65 and over, or people that were disabled, because we don't have sense enough to take care of ourselves. We don't have sense enough to take care of what's important. Now, you don't want to pay $148.50 for health insurance, but the state government mandates that you pay for car insurance. So you can't drive that car without having car insurance. And you're going to cover your most prized possessions, your beautiful home, with insurance. Well, this is what I tell my clients. The person that you least like the most in your family is going to be the one staying in that house and driving your nice car if you're dead because you didn't have health insurance. So do you want to not afford health insurance, Medicare insurance, or do you want to leave your assets behind? And most people don't even have a will, so your stuff winds up in probate. So take care of this, because without this body actively working, none of the other stuff is going to matter. So think twice about delaying your Part B, because it could cost you extra money later. Now, Part D plans, drugs, D for drugs, started in 2006. They're the newest addition to Medicare. So Part D plans help cover the cost of drugs. And your Medicare options. Again, when you first enroll in Medicare and during certain times of the year, you can choose how you get your Medicare coverage. There are two main ways to get the Medicare. Now, a lot of people want to steer you towards one type over another. They'll say, oh, the Medicare supplement is the best because you have no out-of-pocket cost or expenses, but you forget you have a higher monthly premium. So no one plan fits everybody. So we talk about your needs and your budget. So original Medicare has Parts A, and B, like we started, you can add a Part D drug plan. And you see the pictures there. There's that Airbnb called a hospital, Part A. So Part A, hospital. Part B, medical, that covers those doctors. You can add Part D, drugs, that covers the drugs. And you can add a supplement. Notice that they're all separate. You'd have to pay a separate Part D prescription drug premium, and you'd have to pay a separate premium for your supplement coverage. So a Medicare supplement or Medigap policy is going to cover the cost that original Medicare doesn't cover, but you have to pay for that supplement, a monthly premium for that supplement. Now that supplement starts out at a certain amount cost each year when you turn 65. Now, it's going to go up as you get older. So a supplement is not going to stay the same price. Neither will a Medicare Advantage plan. Some of the Medicare Advantage plans stay the same price year after year after year, but they can go up. But a Medicare supplement, it will go up when you age, they're age banded. So you can add. Add means more money. You pay more money. Now, the other choice is Medicare Advantage, also known as Part C. And I hear it all the time, especially when we first started. I ain't never heard of that. What's that? Part C. Oh, it costs what? It must not be good if it doesn't cost that much money. I hear it all the time. But because you don't know about it doesn't mean that it's not good, because you did not read this manual. So when I first started working with Medicare insurance, I asked the people where their manual was, and they said, I don't know. And I looked out of the corner of my eye, and it was under a pot catching water. So where's your Medicare and your manual? And I collect them. You can mail them to me. I collect them for my seminars. But because of COVID-19, we've stopped doing seminars as much. We can do them, and we're fully equipped to do them with all the PPE gear. So we do some, but not a lot. So that's why we're doing the videos. So Medicare Advantage Part C is an all-in-one plan. So a supplement is like car insurance. It's like house insurance. You're going to pay that higher monthly fee to cover you in the event that something happens. So that Medicare supplement policy is going to cost more. Now, my mother said she never had not one car accident that she caused. She had one accident where the deer hit her. She said, I did not hit that deer. The deer hit me. And so that was the only accident. My mother paid, she's been driving since she was 16, as most of us have. So she's been paying car insurance for years and years and years and years and never had to use it. Same thing with the Medicare supplement. You have that coverage there in the event that something happens. Okay, so that's what a supplement is. It's like car insurance. It's like house insurance. Now, Medicare Advantage Part C is like your employer group plan. It's like what you are used to. So in 1995, test question, in 1995, Medicare Advantage plans were started. So Medicare reached out to the same private insurance companies that started the contract with Medicare supplements in 1980. Medicare Advantage plans were started to answer people's question, why do I have to pay more for Medicare? I already paid Social Security taxes, Medicare taxes, FICA taxes. I already paid that. So why do I have to pay another $148.50? Right? So Medicare's answer to that, 1995, was let's create a plan similar to what people are used to on the job. So that's your Part C plan. So a Medicare Advantage plan is an all-in-one plan, like it says here. They're bundled to include hospital, doctor, and prescription drug coverage. And these plans lower your out-of-pocket costs from what Medicare pays. So don't let anybody trying to push a supplement off on you say, oh, supplement is going to be better because you're not going to have any out-of-pocket expenses. Well, the Medicare Advantage plan, some of these have no out-of-pocket costs for how you get your care for certain things, right? So a Part C plan is going to take away the 20% coinsurance for most of the things that you get, like your doctor visit. It takes away your doctor deductible of $198. It takes away your Part A hospital deductible of more than $1,400. So a Part C plan eliminates some of those higher costs of original Medicare and packages the plan similar to what you're used to paying, like a copay. So when you were working, when you went to the doctor, you may have had a $10 copay for your primary care or $20 copay for your specialist. So that's what a Part C plan does. It mirrors what you're used to having on the job. And these plans come with Part D coverage. They come with extra benefits that you don't normally get, that you have to pay a separate premium for. They come with dental coverage. Some of them, not all of them. They come with vision coverage. They come with what we call over-the-counter coverage, or OTC, where you can order Depends. You can order Chucks. You can order a heart rate monitor watch. Some of them even come with like Fitbits. So people ask me, especially my military people, if you're out there, you say, Patricia, I have TRICARE, I have Champ VA. I get coverage for everything, right? So why do I need this plan? Well, you don't need it, but you can get it. So these plans offer you benefits such as the dental, the vision, the over-the-counter, even transportation. And for those of you who have diabetes, you can get your Lancet monitor and test strips at no cost. For those of you who have end-stage renal disease, some of these plans have unlimited transportation. How big is that? I just talked with a client yesterday, December 31st, who called me at the last minute and said, I'm on dialysis. I need that plan with unlimited transportation. Well, it's too late because you missed the December 7th deadline, but because you're diabetic, I can get you enrolled in a special needs chronic illness plan. So I did an enrollment yesterday for someone who missed the annual enrollment period, but qualified for a special enrollment period that came with some transportation coverage. It's not enough to carry him for the whole year, but it's enough to get him there now when he needs it. Because prayerfully, through the blood of Jesus, he's going to come off dialysis. So we are hoping and praying for him and everybody who's out there suffering. So now, lower out-of-pocket costs. So now you have original Medicare, or Medicare Part C, and Medicare supplements. So now, not going to spend too much time on the next couple of pages, but they show you original Medicare versus Medicare Advantage. And they spend a lot of time on talking about the differences between original Medicare and Medicare Advantage, because most people who are on Medicare choose a Medicare Advantage plan. Now, I do have some clients that are on supplements. My clients that are on supplements are those people who aged into Medicare, who were already receiving treatments for cancer. And so they didn't have to answer those medical questions because they were guaranteed issue. So I have a husband and wife couple in Statesboro. Both of them have birthdays around the same time. And so they both had similar effective dates for their Part A and B. The husband chose a Medicare Part C plan because he's not sick and he didn't want to pay the higher cost of the supplement. Now the wife, she goes to Texas for her cancer treatments. She does experimental cancer treatments in Texas. So quite naturally, the Medicare supplement was the right plan for her. Now, if you have a low income and you qualify for Medicaid, a supplement is not for you. Don't even try that. And I have met many people with a supplement with less than $1,000 a month income, with less than $1,400 a month income, fighting to pay the grocery bill, the light bill, the water bill, the mortgage, the rent, and that car insurance and their house insurance, right? But they are struggling to pay for a supplement. So those people, depending on your needs, we find out which one best fits your needs. And we don't cut corners. That's why we're going straight through the Medicare and You manual, so you can see it for yourself. So now, original Medicare is an 80-20 proposition. After your Part B deductible, then you pay, Medicare is going to pay 80% and you pay 20%. It's right there in black and white. Okay, you can see that. And you pay a monthly fee for Part B. You're not paying for Part A because you had to work 10 years or 40 quarter hours and have Social Security taxes or FICA taxes taken out in order to qualify for Medicare, right? So now, I have some people, I think Bartow County, some counties, some places did not take out Social Security taxes, and there's some school systems, they don't take out Social Security taxes. So the only thing that you're eligible for is Part A. You're not eligible for Part B. So those people nearing retirement find out, hey, I get to pocket all that money. I don't have to pay anything Social Security, but now I'm 65. Now what? I don't have health insurance but Part A. So how am I going to get Part B? Well, Part B is quite expensive. You don't even qualify for it because you don't have that 10 years of Social Security taxes paid in. So these people have to go back to work on a job just to get that 10-year experience paid into Social Security. So think about it, ask about it on your job. And now if you're self-employed, oh, you're the worst. My waitresses, the worst. Because you get all that tip money, right? And you put it in your pocket. And you say, I am cha-ching, cha-ching, cha-ching. You buy whatever you want. And you don't put anything back into Social Security, which is going to hurt you. I have a client who because she didn't put anything in. She put something in, but she's got $500 a month Social Security. This is true story. Cross my heart, honest to God. True story. And her rent, her mortgage, she got one of those houses through, Habitat for Humanity, where they build you a house. Her mortgage is $550, y'all. She only gets $500 Social Security. Beautiful brick home in one of these neighborhoods that they're trying to bring up, but she's short $50. So thank God for her children chipping in to pay that $50. So of course, not quite naturally, we filled out Medicaid so she doesn't have to pay for everything, but gas, water, light, food. So if you don't put enough money back for Social Security, you're going to be hurting later. So think about later now so that you'll be prepared, okay? Now, again, original Medicare versus Medicare Advantage. So these Medicare Advantage plans, as you can see on the screen, they must cover all of the medically necessary services that original Medicare covers. Most plans offer extra benefits that original Medicare doesn't cover, like I said, vision, hearing, dental, routine exam, transportation, over-the-counter, even a personal emergency response system. Some of them do. Some of them even give you a food card. And this year for 2021, some of them even have light house cleaning. But you have to be eligible through your doctor. Of course, your doctor writes the order for that. So there are many different choices that you're eligible for that you don't know about because you call the 800 number off that commercial on your beautiful TV. They're not going to tell you. If you call Humana or if you call, if you call one of these companies on the screen, Aetna, Humana, United Healthcare, each one of them has all these different commercials. If you call one of those companies, they're only going to give you a representative that represents that one company. So as brokers, we represent all of those companies and are able to give you a fair view of every one of them to find the one that best fits your needs. Okay? So that's the drawback of calling that 1-800 number, because you're only going to get someone that works for that particular company. Now, drug coverage included in most of the plans. That's an extra benefit. Now, some of these plans don't come with drug coverage. For my people with TRICARE or Federal Blue Cross Blue Shield, those people have drug coverage through their plan. So you don't need a plan that comes with drug coverage. So we put you in what's called an MA only plan that doesn't come with drugs. Okay? So let's keep going. We're going to skip all over that, and we're going to the index of topics. We're going to go over that later, because I'm going to teach you how to use this manual, okay? But we're going to come back to this later in another segment, because I'm going to pull out some very special things. So now, signing up for Medicare is going to be our next segment. Thank you.